So, doctor, I want to know, like, if someone is young, they are active, and they look super fit, so is there a chance that they can still have blood pressure?
Yes, the outside look of being slim and fit need not reflect that patient is not having blood pressure. He still might have high blood pressure because of his lifestyle, which involves excessive working.
What about phone habits like social media? Are these really causing blood pressure problems, or we are just overreacting?
Yeah, in an era of digital practice where we are constantly either on laptops or mobile phones, you are constantly exposed to blue light, which affects your sleep and wakefulness. Constantly, your brain is stressed out, and it is very important in the digital era. We put off our phones at least 30 to 45 minutes before we sleep.
Is there a link between early hypertension and fertility or sexual health in young adults?
There is definitely a relationship. If you are stressed out, your sexual activity goes down, and maintaining a proper blood pressure is very important.
What role does alcohol and weekend drinking play in hypertension risk?
Alcohol is a boon and a bane. Excess alcohol causes liver disorders and probably cardiac disorders, but taking in controlled way, one glass of wine or 30 ml of alcohol a day probably causes vasodilatation and probably lowers the blood pressure.
And suppose a young adult is just diagnosed with high blood pressure, so what should be the first 3 4 action steps? Okay, so I would like to ask you the first question. Like, blood pressure is something people usually get after the age of 50 to 60. So, why are so many young adults facing it now?
You're very right. It was a belief in the past that blood pressure is a disease of plus 50, but no longer so, because nowadays we see a lot of youngsters getting blood pressure in 20s and 30s. The most common reasons for this is patients are becoming more and more competitive. There is more urbanization. Then, most important is change in lifestyle. We are sitting longer, we are not exercising, we are having our meals from apps and not from the kitchen. We are having a lot of stress throughout the day, and because of stress, both body and mind are constantly acting, and this causes a lot of accelerated aging in the body, and BP is the first reflection of stress.
So, doctor, I want to know, like, if someone is young, they are active, and they look super fit, so is there a chance that they can still have blood pressure?
Yes, the outside look of being slim and fit need not reflect that patient is not having blood pressure. He still might have high blood pressure because of his lifestyle, which involves excessive working, either excessive intake of salt or excessive what you say thought processes and goal achievement thoughts. All this will lead to what you say you're being exercising in gym, and you probably are trim and fit from outside, but inside your body is inflamed, stressed, and metabolically deranged. So basically it is a condition where you're fit but unwell, and blood pressure can still exist in people having fit look and trim look because of their lifestyle, because of their what you say adaptation to life might not be relevant to medical fitness.
So basically, even though you look fine, it is not necessary that you are fine. Yeah.
No, not at all. Not at all. You should be definitely checking your blood pressure right from the age of 25.
Okay.
Being trim and fit is not the answer. Probably it is only outside look which makes you,
Look
what you
fit.
say, look
Yeah,
fine, but internally you have to get your parameters checked, and blood pressure is one of them.
very important, right? So now I would like to know, like, are there any early signs in young people which they can watch out for?
It is very tricky, but yet, if you get following symptoms, you should definitely get your blood pressure checked. Most important being feeling of fatigue, having pain in the nape of neck, having blurred vision, having headache frequently, having what you say breathlessness on minimal exertion, and you are having stress, feeling of stress. Even if all these signs are absent, then also it is always not good to guess that you're all right. Better check your blood pressure.
Okay, so it's necessary to check our blood pressure. We'll keep that in mind, sir. So, doctor, now let's talk about stress, especially like in our generation, it is a very major factor. Like, so do it contributes towards your blood pressure?
Stress is a very important contributory factor for blood pressure. Stress is no longer occasional, it has become a constant part of our daily routine because either you are having target oriented, career oriented feeling of left out, that is FOMO, or you are having pressure of giving EMI, career goals to be achieved faster than what you always believe to, and all these features lead to your body being constantly under stress even when you're taking rest. Your mind is not taking rest. So basically, all these things lead to a constant turbulence in the body metabolism, and it always keeps your sympathetic system active, and this causes increased blood pressure. Stress is nowadays a constant feature in most of the people's life. It is not occasional nowadays. Initially, in the older days, people used to have stress for short period, but now we have short period of good time.
Can you share an example about someone you have treated and like they had no idea that their blood pressure was high?
Definitely, we have a lot of young people between the age of 25 to 30. I'll give you one example. He was an engineer. He was complaining of constant headache. And when we checked the BP, it was hovering around 150/95. We suggested that you do have hypertension, but if you follow the rules of the game, probably your requirement for pills will not be there. And we advised, since you are in the borderline zone, try lifestyle modification, in which we gave him an exercise schedule of 30 minutes, asked him to reduce salt in his diet by about 3 to 5 grams a day, which meant you should avoid pickles, chutney, salty food, and fried food. Then go to sleep properly, that is by 11 o'clock, hit the bed. Stop your digital phone half an hour before your sleep, and definitely exercise daily and have a healthy routine. After 3 months, to his shock, by proper sleeping, decreasing his salt intake, and regular exercise, his blood pressure returned to normal. But that does not mean he will be not having blood pressure in the future, because he is an engineer by profession, which will have a lot of stresses. So this ensures that he should get a BP regularly checked up once in 6 months or at least once a year, and keep a check on his lifestyle constantly. It is not just for these 3 months what he did and brought back his BP to normal. It should be on a regular routine basis, lifelong.
So basically, consistency is important.
Yes.
Absolutely. That's very true. And it shows like how lifestyle hits us silently. So, doctor, at what age you recommend people to start getting their blood pressure checked?
It's a very pertinent question. In the present era, where we were not even checking health status of people about 2 decades ago, Now we start checking their blood pressure, blood BMI at the age of 25. I think probably that is one of the good ages to start checking your blood pressure. See into their lifestyle history. Are they stressed out? Do they have a family history of blood pressure? Are they overweight? Or are they frequently having stressful working hours? If they do have so, check the blood pressure once in 6 months or yearly basis, and once they exceed a number 140/90, they should be under constant surveillance.
Okay, okay. So basically, at the age of 25, in every 6 months.
Yes.
What about phone habits like social media? Are these really causing blood pressure problems or we are just overreacting?
Yeah, in an era of digital practice where we are constantly either on laptops or mobile phones, you are constantly exposed to blue light, which affects your sleep and wakefulness. Constantly, your brain is stressed out, and it is very important in the digital era. We put off our phones at least 30 to 45 minutes before we sleep to ensure a good night's sleep, which is very essential and an important causative factor for development of hypertension if you do not have a proper sleep. So in a digital era, most important thing is stop your activities 45 minutes before you sleep.
So sleeping peacefully is what really matters.
Yes,
Okay.
it's a very
And
important piece of advice.
yes, sir. And suppose a young adult is just diagnosed with high blood pressure. So what should be the first three, four action steps?
You should always insist on most important. Inculcate exercise 30 to 45 minutes a day. Avoid salty food, pickles, papad, chutneys. If you are overweight, try to reduce your weight and definitely indulge in some form of meditation and a proper sleep.
Okay.
So
Okay,
basically,
okay.
there are four M's, that is move, exercise. There is meal, do not order from apps but use the kitchen. Manage your lifestyle and monitor your BP every 6 months or so. Simple 4 point formula you can use.
Okay, sir. Definitely we will keep that in mind. But what if like medicine is needed? So will be for like lifetime?
We have seen medicines is an important aspect of treatment, but there are few facts. If adhered to or achieved, probably you may be off medication. Few examples are if you are overweight by more than 20 kilos, every 10 kilo reduction in your body weight causes a blood pressure reduction of about 10 by 5, that is 10 millimeters systolic and 5 diastolic. So if you reduce by 20 kilos or if you reduce salt to 3 to 5 grams a day, you can reduce your BP by 3 by 5, 5 systolic and 3 diastolic. Or if you adapt DASH diet, that is Mediterranean diet, which is a lot of salads, fruits, and vegetables, probably you reduce your BP by about 5 by 3, that is 5 systolic and 3 diastolic. Then if you exercise daily, you reduce your BP by almost 10 by 5. So all these methods, probably if you are in a borderline area where your blood pressure is hovering between 140 to 150 and diastolic 90 to 100, by adapting these methods of weight loss, loss of decreased salt and regular exercises, probably will stop the need for medication, but with a word of caution that you should get your blood pressure regularly checked, and once you cross 140/95, despite these things, you probably have to take medicines lifelong.
Okay, so it is preventable if we take precautions.
Yes.
Okay, sir. And if you have to give just one line to all the 25 to 40 years old who are watching us right now, so what would that be?
The biggest advice is look life in a proper perspective. Leave all your stresses of work at workplace and relax at home. And most important, be off digital field at least 45 minutes before you sleep.
Hmm. Okay, sir.
Don't guess, but get your BP checked. That is most important after the age of 25.
After the age of 25, we should check our BP. We should keep the phone before 45 minutes. Yeah, regularly, absolutely. Keeping the phone 45 minutes prior and reducing the salt intake and doing exercise. Like, have I summarized it?
Yes,
Okay, we will keep that in mind, sir. Definitely. Is there a link between early hypertension and fertility or sexual health in young adults?
there is definitely a relationship. If you are stressed out, your sexual activity goes down, and maintaining a proper blood pressure is very important. A cool mind, a peaceful, ambience is very important for sexual activity.
Can energy drinks and supplements contribute to rising blood pressure in youth?
Definitely, energy drinks like Red Bull and other drinks have a lot of carbonated drinks. These are so they have high sodium content, and probably overconsumption of these drinks will definitely affect the blood pressure of youngsters.
And is white coat hypertension real in young people and should it be treated?
Is an entity which is increased blood pressure in the clinic of the patient when the patient goes to doctor's clinic, and he will have a normal blood pressure at home, and this entity need not be treated. Only psychological treatment is enough. Patient should meditate and exercise so that he remains calm, and that is what is needed for white coat hypertension treatment.
What role does alcohol and weekend drinking play in hypertension risk?
Alcohol is a boon and a bane. Excess alcohol causes liver disorders and probably cardiac disorders, but taking in controlled way, 1 glass of wine or 30 ml of alcohol a day probably causes vasodilatation and probably lowers the blood pressure. In excess of that, it can be dangerous and detrimental. Yes, the level of intake should be very important. And for that, the described methods are 1 glass of wine or 30 ml of whiskey or vodka.
Okay, I hope our audience take that into consideration. But well, I don't drink, so audience do take that into consideration.
It is a piece of advice because alcohol is very important for socializing. So you should socialize, and that is a way of relaxation and reducing your blood pressure. But while socializing, you should limit yourself in total intake of alcohol along with snacks what you take. They should not be very salty. Prefer to take salads and fruits rather than salty snacks what are associated with the drinks. They are very important. More than alcohol, the associated drinks products are dangerous for causing hypertension. It causes increase in weight as well as blood pressure.
So, sir, thank you so much for this session. It was wonderful and very insightful. I am sure our audience have learned a lot, and so have I. So, we were really honored and grateful for you to be here with us.
Thank you so much, and I wish you all a very healthy life. Start looking at your blood pressure right from 25. Avoid digital screen usage before sleep and inculcate a method of exercise. Be fit, not fat, should be the mantra. And fitness should not be only visible outside, but you should have inside fitness in form of being cool so that all your body is not inflamed. Nowadays, most of your diseases are related to inflammation, obesity, hypertension, heart disease. Lot of inflammatory markers are being checked to see the presence of these diseases, and this can be reduced by being calm and avoid the health tips which are given to you. Please adhere to them.
Stay tuned on our podcast series, Heart to Heart. And do not forget to like, subscribe, and share this with your friends and family.